Now we're going to bend this knee. Going to cross it over. Already? Where at?
This hip is like in here and on the outside.
Okay, so without me, I'm not going to go any further because I already know that that's going to cause pain. So right there and right out here. Okay. So relax, just like bend the knee and cross it. She couldn't even get to this right here. Now, even just like, how does that feel?
It's amazing. It's so much better.
Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, as you were just telling me, you are currently working in Charlotte, originally from Illinois, and so that you're working in Charlotte, you have, at the end of your, the 13-week period, you said, and figured, might as well come here while you're close enough. What was it, about a 2.5-hour drive or so?
Yeah.
Okay, so 2.5-hour drive to come over here to Spartanburg, South Carolina to get an adjustment, which, definitely loving it. Now, as you were telling me, so the main thing is really going to be that low back and hip pain, but you do also have pain at that base of the neck.
Right.
And it's just right in through here, correct?
Correct.
Okay. So today, all right, so we're down here in the low back and up at that base of the neck. And as you were telling me, the pain stays in the low back. It does not travel down into the legs, anything like that. It's all local. Constant, though.
Yes.
Okay. And you've been having this for how long?
For a long time.
Years?
Yeah.
Okay. All right, so years of low back pain, even also years of pain up here too as well? Okay, so, I mean, this is not something that is normal or should be, you know, like lived with. What are things that you've done in the past to try to help with the pain?
I've had a couple adjustments, mostly just like stretching kind of stuff, but it's only temporary for the most part. Okay,
and did it, when you say temporary, was it like quick, like how are the adjustments?
It'll be a release of the pressure or the tightness that's in there, but it would kind of sort of just come back.
Okay, alright, so after we do everything today, I want you to tell everyone how your experience was today compared to other things that you've done in the past.
Okay.
Sound good? Okay. So what I want to do, I want to get a baseline of where you're at. We're gonna do some orthopedic tests. We're gonna do some ranges of motion, just kind of see what's going on, if anything's flaring up. Granted, some of the things might hurt you. I'm not trying to torture you by all means, just trying to get a positive out of things. Okay. We're gonna start with, I want you to look all the way up at the ceiling. Any pain with that?
No.
Look all the way down at the ground. Any issues there?
It's a little tightness.
A little tightness, okay. If you would bring one ear to one shoulder and then to the other side, any issues with that?
No.
Okay, and if you were to look over either shoulder, any issues there?
No.
Okay, good. Alright, I'm gonna have you sit up nice and straight for me. I'm gonna push down on the top of your head here. Any pain with that?
No.
Good. We're gonna turn you to the side. Any pain there?
Just a little bit.
Where at?
Kind of over here.
Right in here? Okay. More at the base, like down here? Okay. And we're going to turn you to this side. Any pain with that?
Yeah. Same over here.
Same over here? Okay. So on the base of the neck, more on that right side. Alright, I am going to lift up. Okay. Any increase or decrease in pain? Stay the same.
It's no pain.
Okay, good. And we're going to depress the shoulder. Any pain with that?
No.
Good. Any pain with that?
No.
Good. I'm going to have you stand up this time. If you're to bend down at the waist, any pain with that?
No.
If you're to come back like this.
Yeah, it's just the lower back.
Right.
Same place.
Okay, same. All right, right in the center. Okay. If you're to come to one side or to the other.
Well, yeah. It's
What do you feel?
more pain on this right side.
Okay.
More so than the left.
More so than the left. Okay.
Yeah. Right
and
there.
if you were to rotate, no pains with that? Okay. I am going to have you lay on your back for me first. Good. And so we're going to do some orthopedic tests. Now I'm going to raise this leg all the way up. Let me know if you have any pain in the low back or the hips. Any pain with that?
No.
If I bring this foot forward.
No.
Granted, you might have some tight hams. Okay.
Yeah.
Now we're going to bend this knee. Going to cross it over. All ready? Where
at? And the hip is like in here and on the outside.
Okay, so without me, I'm not going to go any further because I already know that that's going to cause pain. So right there and right out here. Okay, so relax this leg. Now we're going to do the other side.
Okay.
We're going to raise this leg up. Any pain with that?
No.
Any pain if I flex that? Just tightness?
Yeah.
Okay. And now let's see on this side. Do you notice that same thing here or no?
No.
Okay. So that no pain with that. So now you notice quite a bit of a difference just with that one test there. Okay. Flip over onto your stomach for me.
Okay.
Okay. So I'm gonna have you here. Bring your arms right there. Perfect.
Okay.
All right. I'm gonna bend this knee. I'm gonna lift this leg up. Any pain with that?
Not too much.
When you say not too much, where was there?
In the lower back, just the tightness.
Just the tightness? Okay. If I bring your leg in like this, any pain there?
Just on this right side.
On the right side?
So like a little pull or something.
And if I bring it out to this side, any pain?
No, it's about the same.
Okay. We're going to do the same thing on this side. So I'm going to bend this knee. Pain with that?
Not too much. This is all in the same place.
Same place? Okay. Now, what if I bring this leg in?
No.
Nope. Or if I bring it out? Okay. Alrighty. So now, what we're going to do, I'm going to scan the entire body here, and we're going to be checking for that symmetry. We want that right side to balance out to the left.
Okay.
And then we're going to work our way from the cervical spine, going to the thoracic, to the lumbar, and then going all the way down to the feet, checking the leg length out. So now, we're going to start with palpation. Let me know if any of this is tender in the neck when I push in. No? Good. Okay. Any pain right through here? No. Okay, good. Not too tight of traps, which is a good thing, but I know when we were doing that orthopedic test, when I had you bend your head and when I pushed down, we were getting some positives through here, so I'm going to make sure with the massage device that we're going to also hit those muscles. Just help relax everything. Okay. Any pain through the mid-back?
No.
Good.
It starts there.
It starts here? More pain on the right?
Yeah.
What about the left?
Yeah.
Both?
Yeah.
Okay. So pain at that lower thoracic, that upper lumbar spine area. Now we're getting more into that lumbar spine. Yeah. Any pain through here?
Yep.
Yep, okay. More on the right?
Yes.
What about the left?
Yeah.
Okay. So everything now through here, just with, I mean, I can already hear it in the tone of your voice, this is where we're really getting into more of the chief complaints. If I push over that SI joint?
Yeah.
Pain?
Yeah.
Okay. Pain over the sacrum?
A little bit.
In the left side?
Yes.
Okay. So pain over both SI joints, not as much directly over the sacrum. Now we're going to come and we're going to check the leg length here. As you can tell, that right leg pulls short quite a bit. Okay. And when we scan up the body, so actually everything is looking balanced. I'm not really seeing much of a big rotation, which is a good thing. Right through here, I mean, actually I'm noticing a little bit more on that left side, kind of pushing back out at me. So we're going to definitely be doing an adjustment right in through this area of the spine as well. But let me go ahead. We're going to start with the massage device. I just want to relax everything, so when I make that adjustment, it'll be easier for me to do that.
Okay.
There we go. How'd that feel?
Good.
Good, yeah. Just trying to get everything nice and relaxed. So now we're going to go ahead, we're going to start the adjustment up at that cervical thoracic joint up through here. Okay. So we're going to start on that left side here. Good. Get a nice little bit of movement through there. We're going to drop down just a little bit lower on this right side here. Good. Yeah, I just want to open that up, take pressure off those nerves there. Okay. I'm going to have you take a deep breath in and exhale out. Good. One more time, deep breath in and exhale out. Good. Just go one more time there. And exhale out. Good. There we go. Okay. So before I get to right through here, I want to go ahead and check the sacral area. So I'm going to stabilize on the sacrum right here. I want you to raise this leg up as high as you can for me. As high as you can for me. Is that painful?
Yeah.
Okay.
That's hard.
Relax, I say. I want you to raise the left side for me. Do you notice a difference? You see how the left side actually goes up? Any pain with this left side?
No.
No? Okay. Alright, so what I'm going to be doing, I'm going to be bringing up the table below your hips, and we're going to be doing a drop technique here. So the table will come up just like that, and then the adjustment will be coming down on the table. Now, so what's going on, and I'll actually show you on here just so you can kind of see. So I'll show you first, and then I'm going to lay the spine on your back, so to show the viewers and everything. The reason that right leg is harder to lift up, your sacrum is pointing more towards that left side. So when it points more towards that left side, it's the ligaments from here to here. Here's your leg going back. These are looser, whereas this is pulling already, taut and tight. So when you try to bring this leg up, it restricts it. It doesn't allow you to bring it up. So what we're going to do, we're going to do a drop and a torquing technique to bring it back to the right.
Okay.
So everyone at home, what's happening is, as you can tell, her left leg rose up a lot higher. That's because her sacrum is starting to point towards that left side. So what we're going to do, we're going to do a P to A drop, meaning posterior to anterior, and we're going to do a counterclockwise rotation to straighten that sacrum out. Okay, so what I'm going to have you do, I'm going to have you cross your right foot over your left foot for me. And the table's going to come up from below. And one more. Good. Uncross. Bend this knee. Okay. So now, I want you to try raising that right leg up for me. Do you notice a difference? It actually goes up a little bit, which is a good thing. One though, what I still see is that your body is still fighting a little bit, so I can tell that there are other areas that are still causing a little bit of issues with raising that leg. It went up higher, so we were able to get that sacrum pointed over, but now what I want you to do, I want you to sit up on the table for me. One leg on either side. Yep. Okay, perfect, just like that. And we'll come right here from behind, so what I'm going to have you do, I want you to cross one arm, just like that, good. And we're going to rotate you around like this. With your thighs, just keep them to the table. And I want you to look as far as you can over that shoulder for me. There we go. Drop down just a little bit. I'm going to bring you over here, bring you around, and look as far as you can over the left shoulder. Good. There we go. Okay. Alright, I'm going to have you lay face down again for me. Okay. There we go. Alright, now what I want to do, I want to go ahead, check the leg length here. Let's see what's going on. So it is almost close to being balanced. We're still, bring that back, still a little right short here. So what I'm going to have you do, I'm going to have you lay on your side and face me. Good. We're going to bend that top leg. Now I'm just going to roll you just a little bit. Perfect right there. Alright, keep getting moving. Yep. Good. I'm going to have you flip to the other side. Yeah. Just putting you in that side.
Yeah.
Got that to move. Good. Perfect. Just going to bring this arm around. Good. Lay flat on your back for me. Put that down just a little bit. There we go. Alright, now what I want to do, I'm going to go ahead and do a leg pull. Now you may feel a little release in that ankle and the knee going all the way up to the hip as well.
Okay.
Feel that? You felt how that just pulled all the way up like that?
Mm-hmm.
Good. Yep, and the same thing on that one. Good. Alright, I'm going to have you sit on up. Okay. And come forward. Good. Yep, legs in front. Okay. So now we're getting that area in that low back nice and straightened. I want to check the neck first. And then after we do the cervical spine, I want to go ahead and do that Y strap. Okay. Alrighty. So what I'm going to be doing, I just want to feel how your vertebrae are moving and how they're gliding on one another. Okay. So we're going to just rotate the neck like this. Also on the other side. As you tell, I go a little bit lower each time. Just like to feel how they move on top of each other. Good. Okay, same thing on the other side. There we go. Good. Perfect. Okay, so as we're going to come down, we're going to just do a last thoracic adjustment, make sure everything's cleared out. So I'm going to have you give yourself a big hug here. Good. Now I want you to take a deep breath in and exhale out. Good. And relax right there for me. Actually scoot down just a little bit. Perfect right there. Alright. So now we're going to do the Y strap. So I know this is the main reason on why everyone comes to see me, is with doing this. So yeah, as I get everything already nice and aligned, now we'll go ahead and use that Y strap, get that powerful decompression technique. Okay. Okay. So you're going to have to help me with your hair here. Okay. So we're going to bring this up, over, and then if you could pull it through for me. Perfect. Good. Okay, so then I stand at the top of the table. I distract in that Y-axis. There we go. I may need your help to get this perfect. How did that feel?
Good. Like went all the way down.
Come on up. All right, say that one more time. How did that feel when you got that? If you were to describe this to people at home who've never had it.
It's like a huge like stretch. So it goes like from the top of your neck, like all the way.
You felt it go all the way down. You just felt that,
like, yeah,
just pull apart.
Yeah.
Yeah, what that does is, so every day you gotta realize you've got gravity that's just pushing down and pushing down and pushing down on you. So what this does is we're pulling apart, so we're taking pressure off all those nerves that are exiting the spine, and it allows the body to function and heal. So even I'm showing on a spine, so what's happening, you see how these vertebra, these nerves here are coming out in between the vertebra. So what happens over time, you have pressure that pushes down on all the vertebra going all the way down. And I mean, it may not be much pressure, but over, you know, after a while, you start getting that pressure, and people don't understand why, you know, certain pains may happen, just different issues. And what I do is, so that strap hooks around that base of the occiput, and when we pull, it literally from all the way down here, all the way up, and it removes that pressure on those nerves. So yeah, it's a very powerful technique. Now I know one thing that I did want to ask you, especially from the beginning, you've been to other places. Have you ever had anything like this before?
No, not like the Y strap. I've had some of the side adjustments and things like that. The leg pull was a little bit different. Yeah, and then the warm up for
Just the hypervolt. Yeah, but yeah, that Y strap is that main.
Yeah, because that, like, I feel it. I can still feel like it's kind of like tingling going on, but yeah.
Yeah, so a little. Good. It was good?
Yes.
Worth the drive?
Yeah.
Good.
I say so.
Good, good. No, I'm definitely glad. I mean, this is why I like to film my videos. This is why I like to put things up. I want the world to know just what's going on out there, and just like the different things that can be done for people. You know, so many people think that pain is normal, which or common, you know, things like that, but you know, it really isn't. And you know, even a lot of times, like taking a pill isn't the way, you know, it isn't correcting the root cause of the problem. So, you know, I know...
It's like putting a Band-Aid on it.
Yeah, it's like putting a Band-Aid on it. So, you know, I know a lot of people, you know, they go through life and they, you know, they live through with things, but, you know, if you don't have to live with something, picture if you didn't have to live with, you know, a neck pain, a back pain. Picture if you could wake up every day without a headache, you know, without a sciatica, you know, if you could, you know, run again, if you could jump again, if you could play sports, play golf, you know, whatever it is that you like to do. Picture if you could add that back into your life, and things like that. It's hope and you know, wanting you to get the most out of your life. That's what I'm here for. And you know, I love now being able to show people from all over. Yeah. And you know, it's awesome having, you know, people like you drive in, you know, you've probably passed 500 different chiropractors to get here. I mean, to be honest, you really did. Yeah. But yeah, I just, you know, that technique, it's such an amazing technique, and you know, everyone should experience it sometime. But. Definitely. All right, everybody. I'm Dr. Joseph Cipriano. I would love if anyone is ever looking to schedule an appointment, just go right to the website, drjosephcipriano.com. Send me a message, and I'd love to have you in. Have a good one, guys.
Good.
Hi guys. Sorry, I had the camera turned off, but before she left, and I actually almost forgot to show everybody. Now, in the beginning, when we first put her through the orthopedic test, this test right here. So when I raised her right leg up, when we went to cross it, bend the knee and cross it, she couldn't even get to this right here. Now, even just like, how does that feel?
It's amazing. It's so much better.
And I mean, wow. This was just that one adjustment.
Yeah.
Yeah, that was one of the main things, you know, was that low back.
Yes.
And just that one test, that orthopedic test, you were not even able to perform.
No, at all.
And just from that adjustment. So I just wanted everybody to see that, you know, when doing these orthopedic tests, this is why, you know, so now that, you know, when we redo them, she's even able to, like, now you're able to see the difference just with that. But, all right.
That's amazing.
Good.
Well, this has, like, caused me so much pain, and being able to lift it, and, yeah.
You know?
That's good.
Good?
Yes. Yes. So far.